Hello and welcome. Today I will start with another book. I finished with the case files, I gave a good sample, and now I have these two books, Quick Answers, Signs and Symptoms by these two companies. These books are taking the cases in a format of alphabetical format, like this one, the Signs and Symptoms book. Takes the signs and symptoms and starts alphabetically, like for example, start with abdominal distension, abdominal mass, abdominal pain, and it goes on and on and on in this fashion. It shows you how to do the examination. It shows you how to manage the differential diagnosis and special considerations. Very nice book to read and listen to. I'll start with this one today, inshallah. I'll give a sample. Like I'll read one subject today. We'll be reading abdominal distension, inshallah, and then we'll move to other books again, or maybe we'll have another plan. Maybe we'll go in cycles, as I said before. Maybe because I have OCD, I like to go with things in cycle. So like 3 medical cases from emergency, 3 medical cases from internal medicine, one medical case from each of the other books, and then we'll take one symptom or sign from this book. This is also nice. Another book that goes the alphabetical fashion, but this one it goes through more stuff, more material, diagnoses, exams, diseases, and it's very brief. So I still don't know if it's suitable for my such format that I'm doing in my channel, but today inshallah we'll start with this book. Everybody relax, have a seat, and let's go. Let me first adjust my camera. Nice position. Okay, abdominal distension. Abdominal distension refers to increased abdominal girth, the result of increased intra-abdominal pressure forcing the abdominal wall outward. Distension may be mild or severe. Don't forget, we'll be speaking about the abdominal distension only. We'll speak about abdominal masses as a different subject or a different video, but today, inshallah, will be only about everything about abdominal distension, so pay attention. So, distension may be mild or severe, depending on the amount of pressure. It may be localized or diffuse and may occur gradually or suddenly. Acute abdominal distension may signal life-threatening peritonitis or acute bowel obstruction. Abdominal distension may result from fat, flatus, a fetus, or fluid. Fetus in case of pregnancy or inter-abdominal mass like ectopic pregnancy. Fluid and gas are normally present in the gastrointestinal tract, but not in the peritoneal cavity. However, if fluid and gas can't pass freely through the gastrointestinal tract, abdominal distension occurs. In the peritoneal cavity, distension may reflect acute bleeding, accumulation of ascitic fluid, or air from perforation of an abdominal organ. Abdominal distension doesn't always signal pathology. For example, in anxious patients or those with digestive distress, localized distension in the left upper quadrant can result from aerophagia, the unconscious swallowing of air. Generalized distension can result from ingestion of fruits or vegetables with large quantities of unabsorbable carbohydrates, such as legumes, or from abnormal food fermentation by microbes. Don't forget to rule out pregnancy in all females with abdominal distension. Emergency interventions. This is a red mark that you should keep in mind. All right. If the patient displays abdominal distension, quickly check for signs of hypovolemia, such as pallor, diaphoresis, hypotension, a rapid thready pulse, rapid shallow breathing, decreased urine output, and altered mentation. Ask the patient if he's experiencing severe abdominal pain or difficulty breathing. Find out about any recent accidents and observe him for signs of trauma and peritoneal bleeding, such as Collins sign or Turner's sign. Then auscultate all abdominal quadrants. noting rapid and high-pitched, diminished, or absent bowel sounds. If you don't hear bowel sounds immediately, listen for at least 5 minutes in each of the 4 abdominal quadrants. Gently palpate the abdomen for rigidity. Remember that deep or extensive palpation may increase pain. If you detect abdominal distension and rigidity along with abnormal bowel sounds, and if the patient complains of pain, begin emergency interventions. Place the patient in the supine position, administer oxygen, and insert an IV line for fluid replacement. Prepare to insert a nasogastric tube to relieve acute intraluminal distension. Reassure the patient and prepare him for surgery. This is in case of emergency. So in emergency intervention, in case of you got a patient and it seems like an emergency, this is how you quickly manage initially. So history and physical examination of abdominal distension. If the patient's abdominal distension isn't acute, ask about its onset and duration and associated signs. A patient with localized distension may report a sensation of pressure, fullness, or tenderness in the affected area. A patient with generalized distension may report a bloated feeling, a pounding heart, and difficulty breathing deeply or when lying flat. The patient may also feel unable to bend at his waist. Make sure to ask about abdominal pain, fever, nausea, vomiting, anorexia, altered bowel habits, and weight gain or loss. Obtain a medical history noting gastrointestinal or biliary disorders that may cause peritonitis or ascites, such as cirrhosis, hepatitis, or inflammatory bowel disease. Also, note chronic constipation. Has the patient recently had abdominal surgery, which can lead to abdominal distension? Ask about recent accidents, even minor ones, such as falling off a stepladder. Perform a complete physical examination. Don't restrict the examination to the abdomen because you could miss important clues to the cause of the abdominal distension. Next, stand at the foot of the bed and observe the recumbent patient. Observe the recumbent patient for abdominal asymmetry to determine if distension is localized or generalized. Then assess abdominal contour by stooping at his side. Inspect for tense, taut skin and bulging flanks, which may indicate ascites. Observe the umbilicus. An everted umbilicus may indicate ascites or umbilical hernia. An inverted umbilicus may indicate distension from gas. It's also common in obesity. So everted umbilicus may indicate ascites or umbilical hernia. Inverted umbilicus may indicate distension from gas and obesity. Inspect the abdomen for signs of inguinal or femoral hernia and for incisions that might point to adhesions. Both may lead to intestinal obstruction. Auscultate for bowel sounds, abdominal friction rubs, and bruits. Abdominal friction rubs indicating peritoneal inflammation and bruits indicating aneurysm. Listen for succession splash, which is a splashing sound normally heard in the stomach when the patient moves or when palpation disturbs the viscera. However, an abnormally loud splash indicates fluid accumulation, suggesting gastric dilation or obstruction. Next, percuss and palpate the abdomen to determine if distension results from air, fluid, or both. A tympanic note in the left lower quadrant suggests an air-filled descending or sigmoid colon. A tympanic note throughout a generally distended abdomen suggests an air-filled peritoneal cavity. A dull percussion note throughout a generally distended abdomen suggests fluid-filled peritoneal cavity. Shifting of dullness laterally with the patient in the decubitus position also indicates a fluid-filled abdominal cavity. A pelvic or intra-abdominal mass causes local dullness upon percussion and should be palpable. Obesity causes a large abdomen without shifting dullness, prominent tympani, or palpable bowel or other masses, with generalized rather than localized dullness. Palpate the abdomen for tenderness, noting whether it's localized or generalized. Watch for peritoneal signs and symptoms such as rebound tenderness, guarding, rigidity, McBurney's point, obturator sign, and psoas sign. Female patients should undergo a pelvic examination. Males should go a genital examination. All patients who report abdominal pain should undergo a digital rectal examination with fecal occult blood testing. Finally, measure the patient's abdominal girth for a baseline value. Okay, that's all for this first part of this signs and symptoms book and about the abdominal distension, signs and symptoms. We spoke about the examination, and next we'll be talking about the differential diagnosis. Please don't forget to share, like, subscribe, and comment. Arigatou gozaimasu.